Hello again, everybody. Now I'm going to discuss hearing aid fitting. This is a very exciting part of the evaluation. I get to treat hearing loss and improve one's quality of life. After the hearing evaluation, the patient, along with the audiologist, decide upon the most beneficial hearing aid to fit their loss. Once this is done, we schedule a hearing aid dispense visit within 1 to 2 weeks. We order the aids with all the specifics through various hearing aid manufacturers that we work with. The hearing aid comes into the office. We always check the name of the aids, the serial numbers that are on the aids, the packing slip, so we can confirm that our order is correct. I listen to each hearing aid to make sure it works. I listen to make sure that the microphones are working. I make sure the hearing aids sound clear. Make sure everything's working, the battery compartment. If they have any accessories such as chargers and things like that and streamers, I make sure that when we plug them in, the lights are working and they're on. When all is well, I pre-program these hearing aids on my computer. I use all the audiogram material specifics obtained during the test with the patient. I can fine-tune the hearing aids according to all the different frequencies the patient answered in the test. On the date of dispense is the day that I give you this hearing aid. I make sure that the dispense sheet that I made on my own, I give this to every patient. It simplifies everything that comes along with the instruction booklets in the hearing aid dispense kit. It's got some overview on, red goes in the right ear in the hearing aid colors, blue goes in the left ear. There's rules such as do not get the hearing aids wet, do not sleep with them, do not wear them in an MRI, X-ray, CAT scan, keep them away from children, keep them away from pets. I list all the things that the patient must do. They have to clean the hearing aids every time they remove them from their ears, use a clean, dry tissue, use the brush provided, clean out the wax, keep them clean. I tell them to wear them daily to acclimate to the aids. I show them how to insert them in the ears correctly, insert and remove. I discuss which direction the hearing aid goes into. I discuss the battery, if they have a battery, how to use it, how to protect the battery. Keep the battery door open when not in use to preserve the battery's life. We discuss the battery size, how long the battery lasts. If they're using a charger, we discuss how to place the hearing aids correctly in the charging unit. We make sure that the charging lights are on. We discuss all the fitting on the hearing aid, the tips, the domes, or if they're using a mold. We discuss with them how to make sure the aids are secure in the charging caddy. There's a magnetic attraction. You just put the aids in, you close the charging caddy door, and you discuss with them how long it takes to get a full charge and how much hours they can actually wear this hearing aid on a one-night charge. I tell them if they're using a facial mask or glasses, be very careful when taking off, that you don't take off the hearing aids with your mask. And then I discuss any controls or buttons on the hearing aids. And that would be something like this. There's a toggle switch button here. Top would increase volume, bottom would decrease volume. Some of our hearing aids are wireless, so they talk to one another. This hearing aid has a toggle as well. We can put programs on here. We could put volume control. We go over insertion removal. I use a mirror as a guide with the patients. I also go over the maintenance of the hearing aid. I discuss the fit. I discuss the comfort and the ease of insertion removal. Make sure the patient has that down pat before leaving our office. If the patient's willing to connect their hearing aids to their cell phones, I will guide them along the way, go over all involved with pairing the hearing aids with their phones, and then I install the hearing aid manufacturer's app and walk them through the app. It's good to walk them through the entire app so they know exactly what they're doing.